Hello, I'm Dr. Ruby Gill, double board certified physician and menopause society certified specialist. I use all types of routes for women, very individualized. Our HRT treatment that includes topicals, orals, lozenges, pellet therapy, patches, whatever's necessary for that specific female. With that, let's do our Q&A. What if the hormones make my emotions even more unpredictable? I barely recognize myself anymore. I don't want to feel even more out of control. This is coming from a perimenopausal female, and it's referring to the perimenopausal chaos window, which can start around the age 40. So a lot more attention is going to this age range for women. We're not just waiting for you to hit menopause, feel awful, and then do hormone replacement therapy. We are starting to begin a little bit sooner, and we're calling that supplementation therapy, not necessarily replacement therapy. There are studies that do show longer, better outcomes, brain health, cardiovascular health, bone health for women who do start a little bit sooner. So in that regard, you're not crazy. There is something that happens. Your brain is hijacked. Mood may be off. Your diet may be off. The metabolism, the weight, the bloating, the craving, it all can happen during this perimenopausal window. So you might still be having periods. The periods may be changing. Right before that, your mood may be changing. If it's severely changing, it would be something we call PMDD. Your estrogen controls it affects your serotonin, your dopamine, your GABA in your brain. So when you don't have enough of that anymore, or you're getting a little bit of it with your changed cycles, you're still getting some, but just not what you're used to, your brain feels it. It's going to feel like it was mentally hijacked and there was a free fall in your neurochemistry, and that's where the mood swings will come from, and just not feeling like yourself. So replacing that at a very low dose, I prefer transdermal patches to start with this so that we can really titrate it appropriately. Patients will do really well. So with over the course of 2 weeks, basically you may experience a little bit of breast tenderness, a little bit of headache, but generally feeling well, and then over 4 to 6 weeks feeling like yourself. I wouldn't feel worried about it making more emotional instability. It's actually what would help that for the most part. There's always a caveat to this. If you have a known psychiatric history or diagnoses from when you're younger, and it is something that will have to be looked at in a lot more depth and probably in conjunction with a psychiatrist, for instance. But if you've been very well, happy, generally okay, and then all of a sudden something's just changing within you, or your spouse or partner is telling you that, you may be in that perimenopausal chaos window, and you may need to start with a little bit of hormone supplement therapy.